Hi, my name is Allison Salm. I am a therapist with advanced physical therapy and sports medicine, and I'm here today to go over some exercises with you after shoulder surgery. You're going to get a sheet like this that says Codman's Pendulum exercises, and we're just going to show you how those work. So I'm going to bring in my patient, Sandy. Come on over, Sandy. And I'm just going to go through the exercises exactly how you should do them at home. You're going to be able to follow along the instruction sheet, but this will just kind of give you a better idea of what the exercises actually look like. All right, Sandy, I'm going to have you bend forward. You're going to lean on a table or countertop, whatever you have at home that's comfortable for you. You can do these lying down with the operative shoulder hanging over a bed. I prefer that you stand leaning over a countertop, either in the bathroom, kitchen, whatever, or a kitchen table. And you're just gonna lean your body over just like Sandy's doing right now. You can see that her operative shoulder is just hanging there, like her arm is just hanging there, kind of like the pendulum on a grandfather clock. That's why we call them pendulum exercises. There's 4 different movements or 4 different exercises that we have you do in this position. The first one is going to be left to right. So you're gonna see how Sandy's gonna kind of use her body gently, moving it back and forth, and her arm, her operative arm, is literally just dangling there. She's not doing any active movement from the shoulder itself. She's just allowing the momentum of her body to move the arm back and forth, just like a pendulum. You're gonna do 25 of those. Okay, so now we're at 25, we'll say. All right, you're gonna stop and just let it dangle there again. And then you're gonna go back and forth head to toe. So now she's gonna kind of move her body gently back and forth, and her arm is just dangling there, nice and comfortably. You wanna do this to your pain level. A lot of patients find that this is a really comfortable exercise and one that they kind of feel good when they're doing it, because you want to stay really relaxed, not tensing up any of your muscles, but it just feels good to kind of let it swing back and forth. All right, we'll say you're at 25. Good. You're going to kind of stop, let it hang there for a minute, and now we're going to go clockwise. So just like that. Again, 25 of these. All right. All right, so we're just going in a clockwise motion, just kind of letting that arm hang nice and loose. Good. Okay, we're at 25. We're going to stop and we're going to switch directions. So now we're going counterclockwise, and 25 of those. Good. Okay, we're at 25. You kind of want to stop, just let the arm dangle there for a minute. Awesome. You can come back up to standing, Sandy. Good. Kind of do that slowly because you don't want to get lightheaded or feel like you're going to fall over. That's why it's always good to do this while you've got some support on the non-operative side. You can see Sandy's kind of holding up her arm, just kind of supporting it a little bit, which is great. If you've been given a sling, you want to use the sling for either comfort, or if your surgeon has told you that you should be using it all the time, be using it all the time. After Codman's exercises or pendulum exercises, this is a really good time to ice. It's just gonna kind of help with pain. It'll help a little bit with swelling as well. Elevation is also very important. If you have a recliner chair at home, sitting up in a recliner chair is an excellent way to elevate after you've had a shoulder surgery, and a great time to put ice on the affected shoulder. These exercises should be done twice a day. You can kind of spread them out throughout the day, whatever's comfortable for you. But 25 of each of those twice a day, you'll be in good shape. So in summary, after shoulder surgery, you're going to be prescribed these exercises, Codman's pendulum exercises, to do twice a day, 25 of each exercise, keeping things as loosey-goosey as possible, making sure that you're not tense. You're gonna do left and right, back and forth, clockwise and counterclockwise. If you have any questions about your exercises at any point during your recovery, feel free to call your surgeon's office.